making sure that S2 is louder. And then on the second intercostal on her left side is the pulmonic, and S2 is louder. Now I'm going to turn, using the bell of the stethoscope, and I'll be in the third intercostal space, and the herbs, S1 and S2 are equal. I'll switch back to the diaphragm of my stethoscope. In the fourth intercostal space is the tricuspid, and S1 is louder. Now I'm going to be listening to the mitral for 60 seconds, and S1 is louder, and I'm comparing that to my radial, and they're both equal at 68 beats per minute. So now I'm going to ask my patient to slightly lean forward. Okay, I'll be listening to her apical, using the diaphragm, slightly leaning forward. Okay, thank you. So do you have any history of smoking?
No.
No history of smoking. Okay. I'm going to go ahead and listen to my patient's lung sounds. Okay, so go ahead and take a deep breath in and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. And I'll be checking her mid-axillary. So go ahead and inhale and exhale. Inhale and exhale. Can I ask you to sit on this, please, so we can check your posterior lungs? There we go. So go ahead and take a deep breath in and exhale. Inhale 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 and exhale. Now I'm going to check your lower lobes. Inhale and exhale. Inhale and exhale. Okay, stay seated. I'm going to go ahead and check my patient's respiratory expansion. So I'm going to go ahead and set my hands up like this on her back and then pinch her skin. Go ahead and take a deep breath in. Okay, and chest is symmetric. Go ahead and sit back there. So I'll be performing hand hygiene. So now I have a few questions. Do you have any issues or changes to your bowel movements?
No.
So no changes in consistency, in odor or color?
No.
Okay. So what about your urine? Have you had any changes such as burning sensation, abnormal odor, or color?
No.
No. Okay. So I'm going to go ahead and ask my patient to lay down. So right now she's going to be laying down not completely flat. So my patient is not completely flat. She's about semi-Fowler. I'm going to be inspecting her abdominal area, checking the skin, and just the general appearance of her abdominal area. Okay? So now I'm going to disinfect my stethoscope. I'm going to take the bell of my stethoscope. I'm going to be listening to her carotid artery for any signs of bruise. So take a deep breath and hold it. Okay, exhale. And then I'll be listening to opposite side. Inhale and hold. And exhale. Thank you. I'm checking her aortic, her iliac, and her femoral. And patient has no signs of bruise. Okay, so now I'm going to ask you to go all the way flat on your back. Okay. Now I'll be moving eye level. I'll be checking eye level at her abdominal area, and abdominal area is slightly rounded, and no bounding aortic pulse. Okay, so now I'll be inspecting her abdominal area. So I'm going to go ahead and disinfect my stethoscope. So I'll be listening to all four quadrants for about 1 minute, and I'm going to go ahead and start at the right lower quadrant, and then I'll be moving up to the right upper quadrant, and then to the left upper quadrant, and then the left lower quadrant. So if patient has absent bowel sounds, then I listen to it for each quadrant for 5 minutes. So my patient had about 15 gurgles throughout her whole quadrant, and that is a normal finding. So I'm going to go ahead and take this off. Now I'm going to be percussing my patient. The sound should be timpani, and I'm going to be going in order in the same 4 quadrants. Okay, so now I'm going to go ahead and palpate your abdominal area and let me know if you have any tenderness or pain.
No. 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 No.
Okay, good. Okay, so now I'm going to go ahead and assess her legs, checking for general appearance, any discoloration, making sure that her skin is intact. I'm going to lightly feel her legs, checking for temperature. Patient is warm to the touch. I'm going to go ahead and check edema, and I'm going to press down on her leg. Patient has no signs of edema. I'm going to go ahead and palpate behind her knee and check in the popliteal pulse. And they're palpable. And now the dorsalis pedis. And both are palpable. I'm going to be checking her toenails. Capillary refill is less than 3 seconds. It is brisk. And then on the other side, capillary refill is less than 3 seconds, and both are brisk. Okay. So go ahead and push back on my hand. I'll be checking for the flexion of your foot. Push back, and then push forward. So now I'm going to be checking for range of motion. Can you abduct your leg, and then adduct? Okay. Thank you. Now I'm going to go ahead and do heel to the shin. Good. Okay. So go ahead and sit up. You can sit up and get comfortable. Okay. So that concludes our Okay. So prior to that, I'm going to go ahead and check first her reflex. So I'm going to go ahead and check her reflex. So this is the tricep. I'm going to hit. Okay. So now I'm going to check her her bicep. And I'm going to put a finger here. And now I'll be checking the brachioradial using the flat side. Okay, and then I'll be checking her her patellar. So patient's reflexes are grade 2, and that is a normal finding. Okay, I'm going to perform hand hygiene. So this concludes our assessment today. Do you feel safe here?
Yes.
Do you feel safe at home?
Yes.
Okay, I'm your nurse Charlotte. Let me know if you need anything.